enjoy the moment.
Okay.
All the best.
Thanks.
I have the pleasure of welcoming Dr. Ratul Chatterjee here with me at the DAMS studio. And I welcome all my viewers, all my listeners here. A wonderful day, a great person, a great doctor with me. Great results. Rank 16 in PGI Chandigarh, November 2016, postgraduate medical entrance exam. And rank 122 in AIMS, November 2016, postgraduate medical entrance exam. Let's welcome Dr. Ratul Chatterjee once again at the DAMS studio. Congratulations to you. Wonderful result, Dr. Ratul. How are you feeling?
I'm very happy to have got this opportunity to pursue the subject I want to pursue in an institute that is known for excellence. Also, I'm relieved that I did not make any silly errors that would have cost me the exam again, like in previous cases.
Well, you said you're happy to be a part of an excellent institute. But let me tell you, Dr. Ratul, only excellent people which are par excellence become a part of that institute, which is called the PGI Chandigarh or the AIMS New Delhi. Well, that's very nice to know about your feelings. One very important thing that comes to our mind is that how to prepare for such difficult exams. So let me ask you here, how did you prepare for this exam?
For this exam, I made a schedule for myself to cover all 19 subjects in a space of around 2 months or 3 months actually, and out of that I was able to complete only 14, but I think that was enough in the for these ranks. And also I think it is enough to cover all the subjects once and support that with previous papers of 3 years to 5 years maximum for each exam. That was my I think that is enough for either of these exams.
Well, that's I'm really wondering, Dr. Ratul, here that you said you could only cover 14 subjects out of 19. Well, I really wonder if you would have covered all 19, then the rank would be definitely amongst the first top 2. Anyways, that's very nice to know. And another important thing that comes to our mind is about the management of time when you're preparing for the tough exams like the postgraduate medical entrance. So how did you manage your time?
As far as time goes, I think it is important to choose some kind of Bible for yourself, which you refer to for each and every disease, which for me it was the baby robins, the smaller version of robins. So for every new term that I would come across, I would look it up in that book, and if it was not there, then I would search medical dictionary or something to learn the vocabulary. I think even if you don't actually know the medical science behind every question asked, if you know the basic definitions and vocabulary that is lacking in many people, that will enable you to answer many questions.
That's very nicely answered. In fact, you know, these inputs by the toppers themselves are definitely a basis to make a future plan to succeed in such difficult exams. Dr. Ratul, I go a little, different from the tune of questions here. Our viewers would definitely like to know about yourself. You've done your undergraduation from which college and in which course you were enrolled in DAMS?
I am from MAMC, and while I was in third year, I had taken the postal course of DAMS. As far as the postal course is concerned, it also included the test series, which I think was excellent, which definitely helped me, and I think everyone should take the test series at least.
So once you have mentioned here that the test series were very good, we are referring to the subject-wise test series, the grand test, the mop-ups, and the mock test that we conduct. Can you put some more light? How good was that?
They were good, meaning my plan was that I would try to do each question paper in a span of 1 hour, whereas in the actual exam we have 3 hours, so that there is no chance of having any time issues on the actual exam. And also it helped me practice guessing, because on the actual exams also we have a lot of questions which we don't know, and the dance people also give very weird and esoteric questions that that you probably will not know before attempting them, and if you can guess them right on the first attempt, then it is also possible that on the actual exams you will guess a lot of questions correct. So I think these test series are very important to practice guessing, and I don't think that the ranks that they give are of any consequence, because they are online test series and it is very easy to cheat on them, and so I don't think the ranks mean anything. And I think the explanations that they gave for each question were excellent, and that is all.
That's very nice to know. Thank you very much. Now that you have told that our exams, the DAMS exams that we conduct, whatever tests we conduct, are quite near to the real ones. So, have you taken the CBT that we conduct?
I had taken the CBT last year, I think.
How did you feel about it?
It was good, but I didn't actually check the result in the end, so I'm not sure how I did in that.
Well, you need not to check any results any further. You have got a rank 16 in PGI November 2016 postgraduate medical entrance exam, and a rank of 122 in AIMS November 2016 postgraduate medical entrance exam. We are talking to Dr. Ratul Chatterjee here in the DAMS studio. Well, you said that you were a postal student at DAMS, right? So I think we can have a word about the DAMS publications. With that, I refer to the Last Look series, the CRS series, and the Harrison's Notebook.
Yes, as far as that goes, I think the content in them is excellent, but in since the printing is all black and white, it can be it is not very memorable if you just study those. So I think for orthopedics and another subject, what I used to do was look at any kind of new and unknown topics in those notes, and then look them up from other sources such as Medscape or any ebooks I could find on this subject, and then I would be able to understand those topics. So I think the content in these courses is excellent, but I think they can improve the presentation and include more colors and photos and everything to make it more memorable.
Well, that's very important feedback for us, and definitely we're going to work with it. And just to add on here, I would like to add another information that all the study material that we publish here at DAMS is based on the standard textbooks, and they are revised every year. So moving on, Dr. Ratul, I would like to know, have you decided upon the branch you would opt at PGI, or you are still taking your time?
I have provisionally decided medicine, as it is obviously the biggest branch. It covers the most common diseases that go around, and I think anyone who has a good knowledge of internal medicine can at least take care of most of the basic complaints that occur in yourself and your family members and your friends and your neighborhood people. So I think that is what I want to pursue for that reason.
Well, we wish you all the best with that, and we definitely and sincerely hope that you get the desired branch. Before we finish, Dr. Ratul, any message for your juniors?
Yes, as far as message goes, I think it is important to understand every topic that you study rather than try to memorize things, because in the end it is easier to memorize topics that you understand than it is to memorize grocery lists or something that doesn't necessarily make sense to you.
Would you recommend DAMS?
Yes, I would definitely recommend the test series, and I've heard good things about the classes also. So if you are interested in classes, I would recommend them.
Well, that's very nice of you, and thank you very much. And let me remind my viewers again, we were talking to Dr. Ratul Chatterjee here, rank 16, PGI Chandigarh, November 2016 postgraduate medical entrance exam, and not just that, AIMS rank 122 in November 2016 postgraduate medical entrance exam. Thank you very much, Dr. Chatterjee, talking to us. We wish you all the best in life.
Thank you very much.